We are at Community Dental Care, Maplewood, Minnesota. We have expanded to this place a year and a half ago. We have approximately 85% of our patients are on medical assistance, and 65% of our patients are recent immigrant or immigrant from the Southeast Asian. Yeah, Sean. สบายดีเนาะ Oh, nice, and oh yes, okay. It's just that when he bite, then it's really nice. That is heavy in my heart to think about Mr. Wang's future under the new rule. To say when the denture break and they would not pay for it. To say that when the denture need reline, you can't have a reline. So like Mr. Wang, if the denture is broken, he probably gonna be eating with one denture and chewing on his own gum. You come all the way from Anoka here?
Yeah.
Oh wow, well thank you for your trust in us. Open please. Ooh, that is a huge build-up you have.
Not having a job and relying on support of my family until I can find a job right now, until the economy gets better. I really don't have anything to do. I don't know what to do. The only thing I know what I'm doing right now is getting help through the state until I can get out on my own again.
A young adult would not have this opportunity if you don't have perioscaling, root planing. The gum tissue gonna get worse, and eventually this young adult gonna be losing his teeth. There are two things that can cause tooth loss. Number one is caries. Number two, periodontal disease. Now, they would not get care for periodontal disease. It's amazed me that we say, okay, if we have two kinds of disease, the government will take care of one disease but not the other. And both of them cause tooth loss. A lot of our patients will suffer. Probably end up with the hospital across the street. And even right now, the hospital already refer a lot of patients to us. And in the future, we probably going to have to refer a lot of patients to them by the hundreds per year due to pain caused by periodontal disease.
Apple Tree has trucks, we have mobile dental offices, and we set up those offices for a full day of service year-round. I'm Dr. Michael Helgeson. I'm a geriatric dentist here at Apple Tree. We're very unique in that we provide services at more than 100 locations around the state where we serve some of the most vulnerable children, adults with disabilities, and frail elders in nursing facilities, many of whom have complicated medical problems and face tremendous barriers trying to get dental care.
I have spina bifida. I'm going to be disabled the rest of my life. Well, I don't think it's right in my case because I can't afford to pay for the dentist. And it's like, what is the state for if they don't help us?
Do you have your partials with you today? You do? Where?
It's in my coat pocket.
Oh, in your coat pocket. So we should find.
And now her cleanings are only covered once per year. So with that, she builds up a lot of plaque. She's at a great risk for building up more cavities. Also, we recently made her a partial with the budget cuts as well. Partials are no longer, the repairs are no longer covered. So if a tooth breaks off or if it falls and breaks in half, which does happen in a nursing home, accidents happen, that is also no longer covered.
These cases are our parents' and grandparents' teeth. Most of them are missing some or many of them all of their teeth, and for them to not have these teeth repaired if they've been broken or a class fatted may mean they can't chew. What are we going to ask them to eat? Mush?
Hi, I'm Dr. Dan Rose, a general dentist who practices in Pillager, Minnesota, a town of about 420 people. I've been practicing dentistry for about 30 years, and these cuts that I see coming down have probably been the most devastating to the population that in the most need in the state. I have chosen to care for the most compromised, what I believe to be the most compromised population, and that is the developmentally disabled. This patient right here, he's 21 years old, again a profoundly retarded patient with a seizure disorder. What they see here is the fact that there is significant inflammation in the gum tissue, and there's a tooth that's just about buried in gum tissue because of the swelling of the gum tissue and the inflammation and the infection that's around there. Even now, before these cuts came into being, I could see this patient once every 6 months. It is already less than the standard of care, because if this were in the quote-unquote normal population, a dentist would be seeing this patient probably every 3 to 4 months. So already, before these cuts, they were already demanding that we provide care that was less than the standard of care, less than the best practice, less than evidence-based dentistry would allow. Now we're cutting that out completely. There's no periodontal maintenance allowed in this, and this young man, as I said before, 21 years old, just because he's profoundly retarded, he's going to lose all his teeth.